Full body tattoos are like the ultimate badge of honor in the tattoo world. It's bold, it's personal, and it's a serious commitment. But would you put yourself under general anesthesia just to get it done? Well, believe it or not, that's exactly what some people are doing now. And it's causing some serious issues, bro. Serious issues. Tattoos are everywhere now, not just in subcultures, but they are mainstream. They've become a personal form of expression. And people aren't just stopping at sleeves anymore. People are going all in. Bodysuits, head tattoos, and even blackouts, and some crazy cover-up work.
Oh, under here is a cover-up. These huge blocks, I used to have my area code 337. I was just like, man, that's silly, and it was done really bad.
But here's the catch. Getting those giant full body tattoos is painful. Like, really painful. To understand just how painful it can be, check out my video on body modifications where I cover the Black Project. Oh boy. We're talking hours of needlework, and for some people, that's a major deterrent. The pain from these sessions can be intense enough that it's pushing people to consider something a bit, well, extreme. General anesthesia.
The takeoff piece on my back took 8 hours, one session.
As a surgeon who deals with anesthesia daily, I can tell you, it's no joke.
Were you out for that? Like, what was that experience?
I'm out for all my sessions.
It's not something to just mess around with. When you're put under for any procedure, your entire body is at risk, whether it's for a life-surging surgery or something elective, like a tattoo.
I've always been saying that this is a ticking time bomb, eventually, statistically saying, people at some point are going to start dying. And unfortunately, it has.
Recently, social influencer Ricardo Godoy tragically passed away while getting a full body tattoo under anesthesia. He went into the procedure thinking he'd be asleep, blissfully unaware of the risks involved. But even with medical supervision, things went wrong. And now, the trend of mixing tattoos and anesthesia is raising a lot of red flags, even amongst tattoo artists themselves. And believe it or not, Ricardo is not the only one to have passed away in this manner.
Now, I have very mixed feelings about this as a tattoo artist. I would be very sketched out about the person that's going under anesthesia having some type of complication and possibly dying. Just the whole medical aspect of it, of the person going under, that would totally freak me out.
As more people opt for general anesthesia to endure the pain of body art, the risks grow, especially as this trend shifts outside of medical settings. So when you weigh the pain of a tattoo against the potential dangers of anesthesia, is it really worth it? Let's dive into this discussion today. But first, what do the experts, anesthesiologists, really think about it?
This might be a controversial take on this, but for me personally and as an anesthesiologist, the risk-benefit doesn't balance out on this.
I have some concerns about the potential risks that come with anesthesia for such non-invasive procedure. But at the end of the day, it's his choice and his doctor's choice.
Before we completely write it off, let's take a moment to understand why some people are willing to go to such extreme lengths. To do that, we need to talk about the real pain of getting a tattoo. And trust me, it's not just a quick sting. The process is much more complex. As someone who has endured hours of tattoo work themselves, I'm speaking from personal experience. A tattoo machine works by rapidly moving a needle up and down, puncturing the skin over and over. The needle pierces through the epidermis, the top layer of the skin, and pushes ink into the dermis, the second layer of skin, where the ink stays permanently.
A needle is puncturing the skin at anywhere from 50 to 3,000 times per minute. That's creating trauma, as well as injecting a foreign substance into the skin.
When a tattoo needle punctures the skin, it creates small wounds that damage the dermis, the deeper layer of the skin. Your body's immune system sees the ink as a foreign substance and sends white blood cells, predominantly macrophages, to break it down. However, macrophages are designed to remove smaller biological particles, not large, non-biological ink particles. Since the ink particles are too large to be fully broken down and removed, your body essentially quarantines them in the dermis, which is what makes the tattoo permanent.
What they have started to find is that when the macrophages that engulf the ink, when they die, they release the ink. And then guess what happens? A new macrophage comes in and engulfs that ink.
So the process is more about your body's attempt to fight off the ink, but it can't completely remove it. And that's what keeps the tattoo in place. Sounds pretty intense, right? And it's not just the physical trauma. The pain comes from a mix of things. When the needle goes in, it stimulates your nociceptors, your pain receptors, which sends signal to your brain, making it feel sharp, burning, or even like scratching.
Hear me out. Lead pencil, stabbing your skin a little bit.
So this feels like a bunch of cat claws right now?
Yeah, pretty much. Sometimes it feels like he's scratching an itch, and sometimes it feels like he's digging into me with a scalpel.
Pain also depends on where you're getting the tattoo.
My stomach and my neck were probably the most insane spots to get tattooed. The spots that definitely made me like question my existence and my career path and doing this to other people.
Areas rich in nerve endings like the hands, neck, and face tend to hurt way more than spots with more muscle and fat. The ribs, feet, and inner arms, basically areas with less cushion, are some of the most painful spots. Meanwhile, places with more muscle like the outer thigh or shoulder generally hurt less.
Location of the tattoo is probably the biggest factor in how much a tattoo hurts.
The constant vibration from the tattoo machine also adds to the pain by stimulating surrounding nerves, amplifying the sensation. So it's not just the needle. The vibration makes everything feel sharper. Plus, the longer the tattoo, the more needle punctures, meaning more discomfort. For example, line work can hurt more because it's sharper and more focused, whereas shading might feel a little less intense because the needle's spread out more.
I think lining hurts more personally.
Lining for sure. Lining.
Unless it's over a larger surface area. Then, who knows? But it's not all bad news. Your body actually helps out during this. It releases endorphins, your body's natural painkillers, which can make the process a little easier to handle. Adrenaline also kicks in, making you feel more alert and prepared for the pain. It's like thrilling, not killing. Ouch!
I got my head all blasted and that didn't feel too good.
Yeah.
Head tap, bros. Head tap, bros for life.
But if the session goes long, fatigue sets in and the pain can feel a lot more intense.
But eventually you're going to reach the point where pain just starts to increase. A lot of people say that it's almost like really bad sunburn or a nasty graze, and that the wiping and cleaning at tattoo actually hurts more than the needle going into the skin.
But keep in mind, pain is also subjective. Everyone's pain threshold is different, meaning some people may find tattoos super tolerable while others might feel every single needle poke. Stress, fatigue, and even your mindset can make the pain feel way worse. And so, for all these reasons, some are turning to anesthesia as a way to avoid it altogether.
Typically, you're under anesthesia between 6 to 8 hours, depending on your design, where you'll be closely monitored by the nurses and doctors for the entire length of your procedure.
Just a little quick sleep and voila. Well, not exactly. Let's take a closer look at what anesthesia really is. There's general anesthesia, either inhaled or IV, or a combination of both, where you're fully unconscious, and the anesthesia team breathes for you using a ventilator. This is typically used for major procedures. Both inhaled and IV general anesthesia and the adjuncts used work by affecting your body and brain to blunt pain, induce paralysis, and ensure you have no memory of the procedure.
It's a wonderful tool. They don't remember what's going on. They wake up, the procedure is done, and they usually say, I didn't have any pain at all.
But it's not like a sleep, it's just nothingness. Like, it's like a time jump. You just jump from, before surgery to after surgery.
IV anesthesia involves injecting medication straight into your vein, usually in the arm. The most common drugs are things like propofol. These drugs, an induction dose or a large dose of anesthetic drugs, travel through your bloodstream to your brain and render you unconscious in less than 30 seconds.
Start counting. 20, 19,
Normally, the brain's electrical signals are a chaotic chorus as different parts of the brain communicate with each other. That connectivity keeps you awake and aware. But as someone becomes anesthetized, those signals become calmer and more organized, suggesting that different parts of the brain aren't talking to each other anymore.
Here's the science behind it. These IV drugs act on the central nervous system, specifically targeting GABA receptors in the brain. When these receptors are activated, they inhibit neuronal activity, leading to a sedative effect that both suppresses your consciousness and blunts pain reception. Propofol actually does very little to block or even blunt pain. You just won't realize your body felt pain because you are unaware. Hence why anesthesiologists need local anesthetics to block or add on IV opioids to blunt. Ketamine, on the other hand, is a bit different because it has analgesic properties as well. Now, inhaled anesthesia works slightly differently. Inhaled anesthesia involves breathing in gases like isoflurane or sevoflurane. These gases enter your lungs, get into your bloodstream, and travel up to your brain. Once there, they hyperpolarize neurons, making them less likely to fire and send signals. This slows brain activity and blunts pain. Anesthetic gases also exert their effects on GABA more or less, as well as NMDA or glutamate modulation, direct ion channels, and other mechanisms. Inhaled anesthetics like sevoflurane also enhance GABA receptors, further inhibiting brain activity. But unlike IV anesthesia, inhalation takes a little longer to kick in, especially in adults, usually a few minutes. This delay can be problematic because of the hyperexcitatory phase that can happen while inducing a patient, which I'll let anesthesiologist Max Feinstein explain for y'all.
As we're inducing anesthesia, there can be a hyperexcitatory phase where a patient gets disinhibited and might start moving around, kicking, punching, and not able to interact. So if you tell them to stop moving around, they won't listen because they're in a depressed state of consciousness.
This can be dangerous, which is why in major surgeries, inhaled and IV anesthesia are commonly used together. The next type of anesthesia is sedation, which can refer to anything from nitrous oxide or laughing gas and or other IV administered meds, but in lower dosages. The point is, you're out of it, but still breathing on your own. This is used for intermediate procedures like bladder Botox, upper and lower endoscopies, lipoma excisions, finger surgeries, etc. Of course, local is needed for the last few, but sedation would suffice. With sedation, you're typically conscious but relaxed, and it works on your brain to help you feel comfortable while still being somewhat aware of what's happening. But it's important to note that it is rare that only amnestic anesthetic is given in isolation. They are almost always being combined with adjuncts that most commonly include short-acting pain medications or opioids, local anesthetics, other IV sedatives or anxiolytics, paralytics for intubated patients, and of course their reversal, PONV prophylaxis, vasoactive drugs as required, antibiotics, tranexamic acid, etc. Regional anesthesia involves numbing a large area of the body, like freezing your legs with the spinal injection or freezing your arm by injecting into your neck. You may still receive some sedation, but you're generally awake during the procedure. This kind of anesthesia works locally on the nerves, but not on your brain.
Have you ever had ice cream?
Mm-hmm. What's your favorite kind?
Lastly, nerve blocks are similar but more targeted, using needles to numb smaller, more localized areas of your body. Again, sedation is often used with nerve blocks, though it's not always necessary. These are typically used for smaller procedures and, like regional anesthesia, directly affect the nerves rather than the brain.
And an ultrasound machine is used to help your anesthesiologist locate the nerve or nerves they are going to block.
Now, while you could hypothetically just numb the area of a tattoo, some people are opting for full-blown general anesthesia to power through long sessions. What's the issue, you ask? Well, regardless of the type, anesthesia is usually only used in controlled medical settings. And in these settings, general anesthesia is generally safe. Generally. But with anesthesia, we don't really work with generalities. Not only is every anesthesia experience personalized to the patient,
When I go to make my anesthesia plan and I'm picking drugs out of my anesthesia card, I feel kind of like a chef.
and that means anesthesia is tailored not just to the type of procedure, like whether you need muscle paralysis or how long the surgery will take, but also to an individual's biological and health factors that can increase the risk of complications, one of which is age. As we get older, our bodies process drugs less efficiently. Older adults may need lower doses because their liver and kidneys aren't as effective at metabolizing anesthetics. They're more sensitive and have less ability to handle the stress of anesthesia. For children, though, it's the opposite. They often metabolize drugs faster, so they need very careful dosing to avoid undersedation as well as overdose. Next, body weight also plays a role. Obesity can make anesthesia trickier because fat-soluble anesthetics tend to be stored in fat tissue. This can cause prolonged effects or a slower recovery.
Even obtaining an accurate blood pressure measurement is difficult because most blood pressure cuffs
will not properly fit an obese patient. It's also hard to introduce intravenous lines in obese patients because it's simply difficult to find the vein.
On the other hand, people with less body fat may metabolize some anesthetics more quickly. But if they have less muscle mass, the effects of the drugs can be stronger than expected. Certain health conditions can also increase risks. If you have pre-existing cardiovascular conditions like heart disease, some anesthetics can trigger abnormal heart rhythms or arrhythmias, ranging from mild to even life-threatening. Hypotension or low blood pressure is also common during anesthesia, so those with it already may experience even more pronounced drops in blood pressure.
Research indicates a strong link between intraoperative hypotension and serious complications such as acute kidney injury, myocardial injury, and even mortality.
Basically, if not properly managed, the low blood pressure can lead to organ dysfunction or even increase the risk of heart attack or cardiac arrest. Anesthesia can also affect your breathing, obviously. It suppresses the body's natural breathing reflex. And if the muscles responsible for breathing, including the diaphragm, become too relaxed, it can stop you from breathing. Hence why a mechanical ventilator is used to maintain oxygen levels during general anesthesia. Regardless, this is why we gotta look out for people with respiratory conditions,
such as asthma, chronic obstructive pulmonary disease, COPD, or sleep apnea.
These can make breathing even harder, increasing the risk of hypoxemia, or low oxygen in the blood, and hypercapnia, high carbon dioxide levels. The liver and kidneys also play a big role in how your body processes anesthesia, so for people with liver or kidney disease, the body may take longer to process anesthetic drugs, which could result in prolonged sedation or even overdose. This happens because the liver and kidneys are responsible for metabolizing and clearing out the drugs, so if they aren't functioning properly, the drugs stay in the system longer than expected.
So yesterday I got put under around noon and was under for 10 hours. That was awesome.
Then there are also the medications you're taking. Some, like beta blockers, can affect your heart rate, making it harder for the anesthesiologist to control your heart rhythms during surgery. GLP-1 agonists, like Ozempic, can increase the risk of vomiting and aspiration before anesthesia by slowing stomach emptying. Antidepressants or antipsychotics can interfere with anesthesia and make it difficult to predict how you'll react. These medications may also affect your body's ability to regulate blood pressure or temperature during the procedure.
It takes more medications to put this population under anesthesia.
Believe it or not, your genetics matter too. Some people are genetically predisposed to metabolize drugs more slowly, making them more sensitive to anesthesia. On the flip side, others might need higher doses because their bodies don't respond as strongly to the drugs.
I basically asked him the question, were you, aware of kind of the, original anecdotal evidence and, which became kind of evidence-based that redheads might require a little bit more anesthesia.
We know that perioperative outcome depend on patients' status, comorbidities, and that genomics may actually impact the likelihood of having complications related to anesthesia.
Dr. Ruth explains that it's not just the gene, it's the omics part. And what she means is that it's not only the genetic makeup, like the DNA, that matters, but also how the body reacts to different substances, processes, and conditions. Like how your body processes anesthesia or responds to stress, for example. And this just emphasizes how crucial it is to personalize the anesthesia cocktail to ensure its effectiveness and safety. Now, let's talk about the complications that can arise during the administration of anesthesia, even in patients who seem like ideal candidates. While rare, allergic reactions can occur. The most serious is anaphylaxis, which can cause a drop in blood pressure, difficulty breathing, and in extreme cases, cardiac arrest.
3/4 of those patients who have anaphylactic shock should be taken to intensive care. The problem is that at the moment, only 1 in 5 private hospitals have an ITU.
You'd hope that in the case of such a reaction, the medical team would be fully equipped to handle it. Malignant hyperthermia, a condition that makes patients react in a life-threatening manner to all inhalational anesthetics except nitrous oxide, is another potentially fatal reaction to anesthesia that can occur during its administration, leading to a rapid rise in body temperature and severe muscle contractions. An overdose occurs when too much anesthesia is given, overwhelming the body's systems. This can cause low blood pressure, slow heart rate, and respiratory failure. And without quick intervention, it can be fatal. It usually happens due to incorrect dosage or the body's difficulty metabolizing the drugs.
Too much anesthesia, like this gas here, turns off all the nerves in your body, including the nerves that go to your heart. You might stop your heart from beating, which can lead to heart attacks, strokes, and ultimately death.
As you can see, the risks involved in anesthesia are real. But with proper monitoring and an experienced medical team, the chances of a complication are minimized. This is why learning to become an anesthesiologist is a 13 to 15-year journey after high school. And this is why using anesthesia outside a hospital is especially risky, because there's a danger of unqualified administrators, incorrect dosing, improper monitoring, or a lack of equipment to handle emergencies. Any one of those factors can be fatal. Hopefully, on the rare occasions that people do choose anesthesia for tattooing, there are medical professionals in charge who are taking into account possible complications.
We have to be able to support this person and keep them alive, worst case scenario, until paramedics can arrive. We had about 6 contingency plans. Well, if this happens, then this is our backup plan, which is kind of part of the anesthesia game as well. You always have a plan A, B, and C. I'm looking at his EKG, the actual electricity in his heart. I want to check that against his baseline, what that normally looks like for him, and make sure that the stress of having the tattoo doesn't change the electricity in his heart.
Chase, hey, can you keep your eyes open? Awesome, can you give me a big cough?
Having a breathing tube in, we have to make sure that we keep his head and neck stable, but also making sure that we give him position changes so that he's not in one position for so long.
But here's my concern. Even with medical staff on board, the preparation for tattoo anesthesia, specifically in terms of patients' prep work, may still be overlooked.
Okay, one more sip of water. Put your head back a little. Good job, swallow it.
Tattoos are often seen as less serious than surgery because there's no cutting involved. So the body's overall health isn't always prioritized. In traditional surgeries, doctors assess the patient's health, run tests, and optimize conditions. This one's key. Whether it's adjusting medications, managing pre-existing conditions, or improving diet and exercise before the surgery occurs. This is known as pre-op optimization, and it ensures the body is in the best possible condition for surgery, directly affecting how well it responds to anesthesia, even if unintentionally.
Every time we evaluate a patient, we have to determine what physical status they're in. They have to be either an ASA1 or an ASA2.
But with the tattoo community typically focusing on artistic expression and the experience itself, health assessments and body preparation aren't always prioritized. Nor are tattoo artists the ones who are most appropriate to do this assessment. This isn't to generalize, but it highlights the integral difference from medical procedures, where health is closely monitored. Sure, when getting a tattoo under anesthesia, some basic medical checks immediately prior, the bare minimum, are likely performed. Well, we'd hope.
We pre-screen all of our clients, make sure that they're healthy enough, but then they actually need to have a physical.
I talked to a nurse practitioner that took me through a health analysis to make sure that I was healthy enough to even go through something like this.
Still, I'm concerned that as this trend grows, more people will enter tattoo sessions without a full understanding of their health and the structured pre-procedure regimen typical in medical settings that sometimes takes, well, as long as they take might be rushed just to get the tattoo done.
Give it to me now.
Now, I'm not saying this was the case of the following incident, but it's something worth considering, especially when the exact cause remains unclear. On January 20th of 2025, Brazilian influencer Ricardo Godoy tragically passed away after being administered general anesthesia before a full back tattoo. He was 45 with a strong following and the CEO of Godoy Premium Group. Godoy planned to have the procedure done at a private hospital in Santa Catarina, Brazil, where medical personnel and equipment were on hand.
At the beginning of the sedation and intubation, he went into cardiac arrest. That occurred before they even started tattooing him.
Even with the proper medical setup, things still went wrong. During the sedation and intubation process, Godoy went into cardiac arrest before the tattooing even began. Despite efforts to revive him, including a call to a cardiologist, he couldn't be saved. This event was tragic, prompting tattoo artists to call for the ban of anesthesia in the practice.
But I think we can all agree on the fact that they don't hurt so much that you need to be knocked out for them. I've sadly been waiting to see this to happen so public health boards can step in and ban this ridiculous practice. It creates serious potential for health risks for an otherwise low-risk service.
That has yet to happen, and with the rise in demand for anesthesia during tattoo procedures, it's even more worrying. Rapper Tyga went under anesthesia for a back tattoo, with multiple artists working on him at once. Dallas Cowboys quarterback Dak Prescott underwent 11 hours of anesthesia for a large leg piece, with a reported price tag around $40,000. Holy crap. The cost alone makes it a luxury experience for the wealthy and celebrities, but the appeal is obvious. A one and done process without the need for multiple sessions. Despite the price, this trend may only continue to grow unless regulations are enforced and people are made more aware of the potential risks.
We as humans can get tattooed without general anesthetic. It's something we've been doing for thousands and thousands of years. It's the general anesthetic that would be the issue.
To sum it up, getting a full body tattoo is a personal choice, but using general anesthesia to numb the pain isn't the right call, in my humble opinion. While general anesthesia is a proven medical tool in a hospital setting, even under near perfect circumstances, it can have complications. Taking it out of those controlled environments only increases the risks. As we've seen with tragic cases, this can lead to irreversible consequences. The risks simply aren't worth it. Tattoos are a form of self-expression, but your health and safety should always come first.
I think also if you want to get it done while being under anesthesia, then you haven't earned the credit of being tattooed. It's an honor to go through that process and the healing and all of it. It's a transformation of your body and your mind. You're kind of missing the most important part.
Personally, I believe that getting a tattoo is not only about the finished product, but that it is also about the journey.
Tattooing is a rite of passage and the pain is part of the ritual, but I do definitely feel this has a place for certain applications.
The pain that you experience when you are being tattooed is part of the price that you pay for earning that piece of art that makes its memory even more meaningful. Kind of like the yin and the yang of it. Without that part of the bargain, it feels to me that you cheated the transaction and didn't earn what you were given in return. Without that, the value of the tattoo is cheapened in my mind. To me, you might as well be wearing a sticker. And while I might respect the beauty of the art that you wear, I can't really respect the sacrifice required to get it, because there wasn't any.
I'd recommend it to someone who has already gone through the tattoo process and has a decent amount of work done. I do feel that experiencing the pain is part of the art of tattooing, but I feel like if you've already put in your dues, you can get a little cheap day.
But I really want to know what your thoughts are. What do you think? Should people be allowed to get tattoo under anesthesia? Does that lessen its meaning? You tell me. Thanks for joining me on this discussion about the safety of tattoos under general anesthesia. If you learned anything in this video, then leave a comment and give it a big thumbs up to feed the algorithm. Be sure to let me know exactly what you enjoyed in the comments. If you think this message is worthwhile, consider sharing the video as well. To learn more about my own tattoos and what they mean to me, then be sure to check out my other video, Should Doctors Have Tattoos? We're working towards a goal of 1 million subs, and we would love to have you with us when we get there. Hopefully in 2025, y'all. Don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.